Okay, let's dive straight into a topic that, well, it touches the lives of millions: how we measure blood glucose.
Hmm.
We've taken a really deep look at the sources you, our listeners, shared with us, articles, some research notes, exploring the whole journey of blood glucose monitors, from the earliest tools right up to the latest tech.
Yeah, and it's quite a journey, isn't it? These devices are um, indicated primarily for people living with diabetes, type 1 or type 2, helping them manage their health day to day.
Right.
And looking through this material, you really get a sense of the incredible evolution from those simple manual checks to now continuous, really quite interconnected systems.
Absolutely. So our mission today really is to walk you through what's in this material, kind of give you that shortcut to being truly well informed on these essential pieces of tech and what they actually mean for managing diabetes.
Okay, so where do we begin? Maybe with the classic, the traditional blood glucose monitors, the kind you usually associate with a finger stick.
Right. Yeah. The method loads of people started with, I imagine. You need that small drop of blood, typically from a fingertip.
Hmm.
You put it on a disposable test strip, and then a little digital meter reads the glucose level. Simple as that, pretty much.
And you get a result back really quickly, usually within seconds.
Yeah.
It's straightforward, gives you those quick snapshots of glucose levels at that specific moment.
Right.
Now, there's definitely recurring cost, isn't there? For the test strips, the sensors.
Yeah, that was mentioned.
But the material we looked at really highlights that this expense, well, it's far outweighed by the costs, both personal and, frankly, financial, of the complications that can crop up if diabetes isn't well managed.
That makes sense. I saw something in the notes too about trying to avoid those, sometimes sore fingertips, mentioning alternate site testing, like using blood from your palm or forearm instead.
Yes, exactly.
Yeah.
That was noted as a way to potentially reduce the discomfort from pricking the same fingers over and over.
Mm.
But it did come with a caveat. The notes mentioned accuracy can sometimes be a little less reliable compared to fingertips.
Oh, why is that?
It seems to be down to blood flow. It just isn't quite as robust in those areas. So it raises that interesting point about, balancing comfort with getting the most precise reading.
Got it. And there were also quick mentions of like multi-test systems for convenience, maybe holding several strips in one go.
Exactly, yeah. Just trying to streamline that traditional process a little bit, make it slightly easier.
Okay, so that's the snapshot method, but the real revolution, it feels like, in recent years has been this move to continuous monitoring. Let's unpack continuous glucose monitors, or CGMs.
Right. This is where things really shift. We go from getting a single reading one moment in time to getting a much, much fuller picture, assessing glucose levels almost constantly on a near continuous basis.
So how does that actually work? What are the components?
Well, the typical setup involves, first, a tiny sensor. It's inserted just under the skin. Then there's a small transmitter that sits on top of it on the skin surface.
Okay.
And that transmitter sends the information to a receiver. Now, that used to be a separate device, maybe like a pager you carry.
Yeah, I remember those.
Yeah. But now, it's very often just an app on your smartphone. Much more convenient.
And crucially, these systems, they measure glucose differently, don't they? Not directly from blood.
That's a key distinction, yes. They measure the glucose in the interstitial fluid.
Yeah.
That's the fluid in the tiny spaces between your cells.
Okay, interstitial fluid, got it.
And historically, this is important, CGMs usually required calibration. You'd still need to do a traditional fingerstick blood test now and then, sort of to check and make sure the CGM sensor was reading accurately, to sort of teach it.
Okay, right. So this is where it gets really interesting because the material points to this, well, massive increase in CGM use, particularly since about 2010. What was driving that? What made it take off?
It wasn't just one single thing, really. It was more like a combination of rapid technological advancements all happening around the same time.
Like what?
Well, the sensors got smaller, for one. Accuracy improved significantly. The research mentioned a reduction in what they called random noise.
Random noise, meaning.
Essentially, the readings became much more stable, more reliable,
Mm.
less prone to those sort of erratic, jumpy fluctuations that weren't real changes in glucose.
Okay, that makes sense. More trustworthy data.
Exactly. Plus, the features got smarter, the algorithms interpreting the data improved, and maybe the most impactful change, connectivity just exploded.
Connected. You mean integrating with other diabetes devices?
Precisely. Think about integration with insulin pumps, which creates what people sometimes call hybrid closed-loop systems, or even connecting with smart insulin pens.
Oh, right.
We saw that specific example in the notes, the 2020 launch of the Medtronic InPen. It was designed to pull data directly from their Guardian Connect CGM right into the same app.
Wow, okay, so you're seeing your glucose readings and your insulin dosing information all in one place.
Exactly. Linking those two things together,
Yeah.
it's a huge step for managing doses more effectively.
And the impact of all these improvements, it's really clear in the numbers, isn't it? That study you mentioned, Lacey et al.
It really highlights the shift, yeah.
Mm.
This study looked at commercially insured kids and adults in the U.S. with type 1 diabetes, and it found CGM use jumped from just over 20% between 2010 and 2013
Okay.
to nearly 50% by 2016 to 2019.
Wow, nearly half.
Yeah, that's a 2.5-fold increase in, well, less than a decade. It just shows how quickly people adopted this tech once it got more reliable and hopefully easier to use.
A 2.5-fold increase is huge. So, okay, beyond just being more convenient, what are the actual clinical benefits documented in the material? What explains that kind of rapid uptake?
Oh, the documented benefits are really substantial. The research clearly indicates that patients who regularly use CGMs, they experience fewer severe high glucose episodes, hyperglycemia.
Highs.
And they may also see improvements in their HbA1c levels, which for anyone unfamiliar is basically your average blood sugar reading over the last 2 or 3 months. So better monitoring often leads to better long-term averages.
Right, because you're no longer just like guessing what's happening between those finger sticks. You can actually see the trends, the highs, the lows, how everything you do impacts your glucose levels.
Exactly. That continuous stream provides incredible documentation. You see how your blood glucose responds to everything you're insulin dosing, what you eat, exercise, stress, even sleep patterns. The notes specifically pointed out the value of that overnight monitoring, helping people spot issues with their basal insulin, that's the background insulin level.
And the alerts. They must be incredibly helpful, right? Having the device flag things up.
Oh, definitely. Many units have customizable alarms for both high and low glucose levels. And that gives users really valuable time to intervene, to treat it before a situation becomes, critical.
Yeah.
And collectively, looking at the bigger picture, this better monitoring and the quicker interventions, it's led to fewer costly ER visits and hospital stays because of severe hypoglycemia. And generally, a reduction in those long-term diabetes-related complications. It connects directly back to better health outcomes and also potentially lower healthcare costs overall.
It really sounds like a win-win. Better health for the individual, potentially less strain on the healthcare system. But are there still challenges or things people need to be mindful of with CGMs? It can't be perfect, surely.
No, you're right. The material does discuss some ongoing considerations, things like ensuring proper calibration when it's actually required for a specific device.
Yeah.
And the availability of control solutions, those liquids you use to check the meter's accuracy sometimes.
Right.
And perhaps most significantly, patient adherence, actually using the device correctly and consistently as prescribed. Because if the calibration is off or if the data isn't interpreted properly, it could lead to erroneous readings and potentially making the wrong treatment decisions based on bad data.
Okay, that makes sense. User technique and consistency are still key. Now, traditionally, CGMs were really focused on type 1 diabetes, where insulin use is pretty much constant, but the material suggests their use is broadening out.
Absolutely. We're definitely seeing increasing adoption in type 2 diabetes as well.
Yeah.
And there was one interesting example highlighted in the notes, the sugar beet device from a company called Nemera Medical.
Sugar beet. Tell me about that one. It sounds maybe a bit different from the typical sensor insertion.
It is, yeah. It was developed specifically with type 2 patients in mind, particularly those who might not be on insulin or maybe aren't at high risk of hypoglycemia. The notes even mentioned its potential use for people with prediabetes.
Interesting. So how does it work if it's not inserted?
Well, it uses a non-invasive adhesive patch with a sensor. And this sensor actually draws glucose from the interstitial fluid on the skin's surface without needing that little filament to go under the skin.
Okay, non-invasive. And how is it used? Is it worn all the time like other CGMs?
No, not continuously. The way it's described, you wear it for about 14 hours during the day, and typically only for maybe 2 to 4 days per month.
Oh, just a few days a month?
Yeah, kind of like periodic checks
Oh.
rather than constant monitoring. The data gets transmitted via Bluetooth every 5 minutes to a smartphone app.
Right.
But the material did note, interestingly, that even this device, despite being less invasive, still requires a once-daily fingerstick for calibration.
Huh. Okay, so calibration is still part of the picture there. What about its availability? Can people get this?
Well, it got a CE mark in Europe back in May 2019, which is the regulatory approval there. In the U.S., it seems to be navigating the FDA pathway.
Okay.
So while it's not yet fully FDA approved for real-time glucose monitoring for treatment decisions, it's currently marketed in the U.S. more as a wellness device, which means it can provide like retroactive reports based on the data collected, but not those real-time values you'd act on immediately.
Got it. Wellness versus medical device. Another huge recent development the material pointed to was the approval of the very first over-the-counter CGM. That feels like a big deal.
It's a major shift, yeah. A real step towards accessibility. In March of 2024, the FDA cleared the Dexcom Stelo Glucose Biosensor System specifically for over-the-counter sale. No prescription needed.
Okay, wow. And who is that aimed at?
Its indication is for adults aged 18 or older who are not taking insulin.
Right, so thinking about who might use this,
Yeah.
maybe individuals managing type 2 diabetes just with diet and exercise? Or perhaps oral medications?
Exactly, that kind of group. The material explicitly stated it wasn't designed for people who experience problematic hypoglycemia, low blood sugar episodes, which makes sense, given it's for non-insulin users primarily.
Yeah.
This OTC option really broadens the potential user base way beyond those traditional prescription pathways. It opens monitoring up to a whole new population who might benefit from seeing their glucose patterns.
Fascinating. Let's just loop back to that connectivity aspect for a moment. You mentioned sharing data with healthcare providers. That seems like a really critical piece of the puzzle for actually optimizing management, right?
It absolutely is. So many modern monitors and CGMs allow you to download the data often to a computer or just directly via app.
Mm-hmm.
And you can easily share that with your doctor or your diabetes care team. This gives them such a more comprehensive picture of your glucose patterns than, old school figure stick logbooks ever could.
Yeah, those logs could be patchy.
Totally. This allows for much more informed treatment adjustments, fine-tuning medication, or suggesting lifestyle changes based on real trends.
I remember seeing an early example of this kind of connection mentioned in the notes somewhere.
Yes, the IBG Star from Sanofi. It was highlighted as one of the very first blood glucose monitors designed to connect directly to an iPhone and iPod Touch using an app. This is quite a while ago now.
Right.
It allowed users to record, track, manage, and share their data digitally way back then.
Yeah.
And the research cited indicated it actually had good precision, too. It was really kind of ahead of its time in terms of integrating monitoring with personal tech.
Definitely paving the way. Okay, so we've traced this evolution from a simple blood drop giving a snapshot to near continuous sensing, connected devices sharing data. What's the ultimate goal described in the material?
It hinted at the artificial pancreas.
Yeah, that's the really exciting future direction described. The push is towards systems that completely automate insulin delivery based on those real-time glucose readings.
Fully automated.
That's the vision of the fully closed-loop artificial pancreas. The idea is with continually improving sensors and really sophisticated calibration software, or maybe even no calibration needed eventually, the system itself can make the dosing decisions, calculating and delivering insulin without requiring manual input from the patient for every meal or correction. Wow, taking the burden off the patient. And the material even gave a really exciting example of this actually becoming a reality, particularly for type 2 diabetes.
It did. A successful trial was mentioned from 2023 run by the University of Cambridge. They specifically tested a fully closed-loop artificial pancreas system for people with type 2 diabetes.
And what was impressive about it?
Well, what was really neat is that it used readily available components like an off-the-shelf glucose monitor and an existing insulin pump. These were combined with a custom-developed app called CAMPS-HX, which did the smart part, predicting and delivering the required insulin.
And the key thing was that it operated autonomously.
Independently.
Exactly. It functioned on its own, reacting to the glucose data, adjusting insulin delivery, without the patient having to constantly calculate or administer doses manually.
So what were the results like? Did it work well?
The results look very promising, yes. The patients using this closed-loop system, they stayed within the target glucose range, which was defined as 3.9 to 10.0 millimoles per liter.
They stayed in that range 66.3% of the time.
66%. And compared to standard therapy.
Compared to only 32.3% for those on their standard therapy.
Wow, that's more than double the time spent in a healthy range.
More than double, yeah. That's a huge deal for someone's daily well-being and, of course, for reducing the risk of long-term complications.
Absolutely huge. So just stepping back for a second, what's the core clinical significance of all this monitoring technology and fostering that patient understanding? What's the bottom line?
Well, ultimately, it really empowers patients, doesn't it? Having access to this data, whether it's from traditional meters or these advanced CGMs, it allows people to truly understand the patterns in their own glucose levels.
Right.
seeing how different foods affect them or different types of exercise or even just time of day. It helps them make much more informed decisions about their diet, their activity, their medication timing. It puts them more in control.
And while the material did note that the optimal frequency of monitoring for everyone with type 2 diabetes isn't completely settled science, experts generally agree that better control, which is definitely supported by monitoring, leads to better outcomes down the line.
Absolutely. No question. And you can imagine, for someone who's newly diagnosed, this technology can be invaluable. It helps them quickly get a concrete understanding of their condition and how to manage it effectively right from day one.
Yeah, a faster learning curve. Now, with all these devices that involve, skin contact, finger pricks, adhesive patches, were there any potential complications mentioned? Downsides?
Just briefly, yeah. With the traditional finger stick meters, the most common issue is pretty straightforward.
Mm,
Just pain or soreness from the repeated pricks. Annoying, but usually minor.
okay.
With the sensor-based systems, the CGM patches, some individuals might experience sensitivity or irritation from the adhesive used to keep the sensor on the skin.
Right, like an allergy or just irritation.
Could be either, which is why rotating the insertion site, or the application site for the patch, is always recommended. Don't keep putting it in the exact same spot.
Good tip. So, okay, we've really covered an incredible journey here. From that single drop of blood giving a brief snapshot
Yeah.
to these sophisticated sensors offering a continuous stream of data, integration with other devices like pumps and pens, now over-the-counter access, and this really exciting potential of fully automated artificial pancreas systems. It's clear this technology is not standing still.
Not at all. It's a field that's constantly innovating, and it's directly impacting how individuals can proactively manage a really complex condition like diabetes.
Yeah.
It's quite remarkable.
Definitely. So, considering all these advancements we've talked about, particularly that move towards automated systems and making devices available over the counter, here's something for you, our listener, to maybe think about as we wrap up. What do you believe will be the single biggest impact these technologies have on the day-to-day experience of living with and managing diabetes in the future?